I'm not up for too many days as a concept. I just feel that days end up becoming a symbol of what we not do rather than what we do, because we end up having one day and then we forget the remaining 364 days also exist. So that's what we've done to most strata of our society. Mental health is for sure. Um, if it's a universal human right, which it is, and the fact that in this 2024, I was last told we are in. So, if we still need to talk about mental health as a universal human right, we should also realize how we have collectively and absolutely failed. Because you really can't be having a civilization for hundreds of years, thousands of years, and then talk about what to do about the mental health rights. It should have been the reverse. You really can't even have a civilization if you don't have mental health on track. And that's where we are. And then we talk about mental health, then we talk about women's rights. We ask the question, do the rights matter? Rights matter. Rights matter of everyone, human beings, living beings. Fact of the matter is that no matter what we say, our words don't meet our actions. I just feel there's just so much whataboutery about our life that we end up saying just so much, and in the words and the grammar and the full stops and the commas, we actually forget that somewhere action needed to be happening. And because action hasn't happened, we'll just keep on having these intellectually stimulating 15-20 odd minutes, and then the traffic jams will take care of it. And that's what it is. Mental health needs to be seen as a right. I think at multiple levels we fail ourselves. I'll start with our own selves. I think mental health professionals probably need to do a lot more than what we've done, right? What we do in our clinical practice needs to be a part of what we do. If we don't realize that there's a whole world outside this clinical practice as well, which needs to be taken care of, it can't be how many patients you saw and what prescriptions you made. I'm sure there needs to be a matrix which is less mathematical than this. I mean, when Murthy was talking about distress, if we start actually addressing distress, we'll probably do a better job at disease also. But we just can't keep on waiting for disease to happen and then look at every few days we come up with trends. And abhi to ye haal hai that we come up with newer disorders every other day. All it takes is 3 people talking about it on social media, and then it just becomes something else. 3 days back, I had an interaction with an HR who wanted an engaging, entertaining 60-minute talk on parenting within and an exercise that lasted for 30 minutes, 60 minutes, where a psychiatrist actually spoke for about 25 minutes and did 30 minutes of Q&A. 30 minutes of Q&A in a 50-minute talk, last I know, was engaging. But the feedback wasn't engaging enough. The tonality was not changing. This was not happening. I think we've actually forgotten. This is not Instagram. And life is not 2 minutes. Nowadays, 15 seconds actually. I was told by a digital marketer some weeks back that, your first 2 seconds matter. I'm so glad nobody told me when I started my medical education, your first day matters. I mean, are you kidding me? It was a nightmare. I still don't remember that first day in psychiatry or first day in MBBS, a nightmare. First 2 seconds matters. They don't matter at all, in fact. If they matter, then you've lost what matter means. You've lost the bus here. And if you want to learn, you learn. If you want to be entertained, go see a film. Assuming they still entertain you for some reason where probably your cognitive processes did not develop well enough that you still want to say the same hash shown to you again and again. That's how it is. We talk about rights. We're just so judgmental. Just look at the campaigns today. It is so embarrassing. Out of the blue, you will have as stereotypical as it gets. You will get today's campaigns, half of them will have a bindi. Half of them will do some Shakti. Half of them will talk about be unapologetic while being highly unapologetic. And apologetic both in the same way if it was even possible. It's just unbelievable. I was, as life is now, while coming here, I was going through some social came across a very embarrassing post on LinkedIn again by a clinician from our fraternity. Impact of, let's say, menopause on mental health. Keep getting judgmental. If it is depression, it is depression. You'll screen for depression, then you'll connect it with menopause, and then you'll create this whole thing. If you have a menstrual problem, you will have emotional disturbances, you'll have mood issues, you'll have menopause, you'll have this. You keep on breaking the cycle first, keep on adding on things which are totally unrelated, by the way, or even if they're related because of multiple factors. At least put all the factors in the context. And then what happens is, then you'll keep going through that again and again and again. You'll see, just look at the last 10 years campaigns. You won't find a difference anymore. We are probably saying the same thing again and again for I now don't even know since how long. Rights matter. So yes, it starts from clinicians like us. We need to understand there is a deficit of experts. I also feel expertization of mental health is not going to work. There aren't enough of us. There will never be enough of us. क्या 300% शॉर्टेज कितना कम हो जाएगा? हमारे लाइफ टाइम में तो नहीं हो. So what is the next? How do you divide your time in the change that you can bring in a community, and then what you do in your clinical practice, of course, and hopefully following evidence-based medicine, if whatever best we can. The next would be healthcare providers. If healthcare providers do not integrate mental health at all levels, healthcare providers are failing us at the next level. You go to any healthcare and you'll get a preventive health checkup done. You have the audacity of calling it a preventive health checkup without having mental health in the context. I dare anyone to define mental health without using the context of mental health. If you can't define health without mental health, how are you doing a preventive health checkup which does not have mental health? Logically नहीं है ना. सबसे पहले तो जहाँ से प्रिवेंटिव हेल्थ चेकअप करा रहे हैं, इफ योर ऑर्गेनाइजेशन एंड एचआर और एनीवेयर एल्स, पहले तो वो कैंसिल कराइए आप, बिकॉज दे आर कॉनिंग यू. दैट्स व्हाट इट इज. Why at both preventive, secondary and tertiary level, mental health is not integrated? You bring a specialist from tertiary care, pick up a cancer specialist, pick up a neurosurgeon here, and the moment they'll start speaking, they'll tell you the importance of psychology. And then you ask them, do you have a psychologist on board? Oh, that we don't have. I talk. You don't talk, you dream. The patient is under anesthesia when you're performing the surgery. What talk you do then doesn't reach out. And then really, you also know who does the post-op care. Which is not honest. My problem is that I was just telling Jitendra that here only, that started lately attending lesser and lesser of these conversations. The pretense, social media's fake portrayal of our fake self has made us forgotten. I mean, completely forget who we truly are. It's like we have, probably we might soon have, the way things are going, we'll probably have filters for our own mirrors because we don't want to see what's in the mirror. So we'll put on filters on the mirror also. यहाँ थोड़ा blue आ जाएगा, यहाँ से थोड़ा green आ जाएगा, वहाँ से थोड़ा फूल आ जाएंगे, यहाँ से थोड़ा पत्तियाँ आ जाएंगी. And then we'll start looking at also like this. Embarrassing. You'd much rather have a non-qualified expert or a pure quack telling you why don't you have an avocado sandwich in the morning. First of all, they taste horrible. Right? I know a lot of you like avocados, they look bad, they taste bad. I'm sorry, it's not bread. I'm a Gujarati, give me good old strawberry jam with bread, I will have it morning, evening, night. Right? But you will say, okay fine, you want to hear this. You want to hear कि नहीं जी डिप्रेशन में तो हम यही खाएंगे. और आपको कितना ही बोल बोल के बता देंगे यार ये दिस इज एविडेंस बेस्ड ट्रीटमेंट. फिर आप क्या करेंगे, कोई एक सिली सा आर्टिकल, कोई एक मेटा एनालिसिस के नाम पे किसी कोने में लिखा होगा, उसको आप छाप देंगे. दैट प्लेसिबोस, दिस इज मोर देन अ प्लेसिबो. देन इफ आई हैव depression, please take me to one of my colleagues here. Please give me a medication, give me RTMS. I'm fine. Just don't tell me that just start jogging and do some breathing in and out and have some amle ka pani and your depression will go away. I'm sorry, it's not going to happen. You will not ask a physician, blood pressure की दवा कब तक चलेगी? हमारी तो चल रही है. 25 साल पहले बोल रहा था थोड़े दिन खा लो, अभी भी चल रही है. और हमने जो लिख दिया गलती से आपको, फिर आप गूगल के पेज लेके आ जाएंगे. एंड द ब्यूटी, जस्ट लुक एट द sheer stupidity of who we've become. Every time I tell a young person don't take cannabis, and let's say if the person has has, let's say, depression or anxiety, and I'm prescribing a medication, I'm going to be asked, what are the side effects of this? My dear, you're having cannabis. And then you'll tell me medicinal usage of cannabis is very good for health. You don't even have the basic intelligence to understand that this is an orchestrated attempt by a mafia that is ruling the drugs across the world, who've given you more data than anybody else could have given. And they pump that data to you again and again. And today you talk about micro dosaging. Micro stupidity is also stupidity. It doesn't need to be macro to be stupid. Stupid is stupid. So you want to talk about rights, be honest. We have failed you. Healthcare providers have failed you. Media has failed us. We talk about things. I mean, every time I get a call, what is the trend now on? I feel like banging my head on the wall. How do you expect trends to happen just because you have a 24-hour news cycle? It can't be trendy, right? It's not a hashtag which is going to change every hour. This is science. Science takes its own sweet time. 50s is when the first medication came. Now there are more medications coming. It's taken us a lot of time to have this change. We failed us because we don't consistently maintain this. And then we have this whole new social that's coming up. We have a social world out there, social media world out there. First, I don't think it's social, right? You can call it digital media for all I care, but just don't use the word social. Social, when I was in school, was a nice word. We just made a mess of it. And it really can't be social if you're going to the washroom with it, right? Or you're sleeping with it, or you're waking up on it, and everything else you're doing. And you really don't need to tell me here, hey, I'm with the legend, Dr. Bora. We are together in the same place. I don't need to do that. If I feel it, I feel it. If I don't feel it, I don't feel it. But if I'm showing it, I most definitely don't feel it. Right? It is so good to know that when we were born, parents did not wish me on Facebook. Now it's kind of embarrassing. Just imagine your dad wishing you, beta, I love you. Stop embarrassing me. Right? And if you don't, then you'll have a problem. That one's right, this one's right. Come on. You want to make a universal right? Let's start with basics. Let's be honest to our own selves. If we are not honest to our own selves, all this is what about it? And it'll all be a trend, it'll be gone. Today we'll celebrate Women's Day, tomorrow it'll be something else, day after tomorrow it'll be something else, and the next. And they'll come up with these nice fancy themes, we'll have nice hashtags, they'll last for a few hours. Assuming something doesn't happen right now, 15 minutes something happens in the political circle, all these trends are over, okay? Then you can celebrate all the days you want, it's all going to be taken over by something else. That's because we are so reactive to a here and now that we are not understanding what needs to be consistently done in a longitudinal axis. You want to change, you bring it in a longitudinal axis. You want to make a road, then you have a chisel in your hand. You have to keep doing it and doing it and doing it and doing it and keep banging at it without stopping, without changing, without any change happening until you actually see the road. The road's not going to happen in my lifetime. Now the question is that the youth that is out there, are you going to do something enough for their lifetime or not? So the question can't be, do rights matter? They matter. The question cannot be, is mental health a universal right? It is. Does it matter enough for us to do something or the other is a question we ask ourselves. So from prevention to community, from clinicians to media, from society to connectedness, from social media to social relationships, beyond the trends and cross sections and here and now moments, the longitudinal axis requires collective, consistent, cohesive, sincere, genuine effort if we want to make mental health a universal right across the board, across the age, across any form of gender or any other form of a bias. That's the only way to look at mental health.